This is an analysis from Alpha Business Media. Today, we're diving into Nepal's incredible health tech ecosystem. It's a story of how some of the toughest conditions on Earth are actually fueling a wave of world-class innovation. So to really get this, you have to understand the starting point. I want you to just imagine for a second that you live in a remote village, high up in the Himalayas. Getting sick isn't just an inconvenience, it could literally be a death sentence. Why? Because the nearest clinic might be days away, on foot, through some of the most difficult terrain in the world. This isn't some dramatic hypothetical, it's the daily reality for millions. And if you want to put that reality into numbers, look at this. Just one doctor for every 25,000 people. The World Health Organization says the bare minimum should be 1 per 1,000. So we're not just talking about a gap here. This is a chasm. It means millions of people have virtually zero access to professional medical care. Now, experts have a specific term for this kind of crisis. They call it a syndemic. And it's a really important idea. It means this isn't just a series of separate problems. It's a cascade, where the geography, the poverty, and the diseases all crash into each other, creating this vicious cycle that feels almost impossible to break. And you can see the ingredients of that syndemic right here. You've got a country that's almost entirely mountains, with most people living in rural areas. Then you layer on top of that a specific health crisis. Nepal has the world's highest death rate from chronic lung disease, a lot of it from indoor air pollution. It's just a perfect storm of environmental and social challenges. The data really paints a grim picture. We already saw that shocking doctor-to-patient ratio, but then add this. Chronic diseases, things like heart disease and diabetes, are now responsible for 2/3 of all deaths. And at the same time, maternal mortality rates are tragically high. The whole system is just buckling under this immense pressure. Okay, but here's where the story takes a fascinating turn. Faced with what seem like completely insurmountable problems, a new generation of entrepreneurs is not waiting for the government to build roads or hospitals. They're leapfrogging the physical world and building a digital one instead, using the tools they have right now, smartphones and the cloud. And what's really smart is how they're attacking the problem from 3 different angles or tiers. First, they're going straight to the consumer, figuring out how to connect patients to care. Second, they're rebuilding the infrastructure, the digital backbone for the hospitals. And third, they're tackling the hardest piece of the puzzle, getting diagnostics to the most remote places you can imagine. So let's start with that first tier, patient access. And the company to watch here is called Givi. Think of them as creating the digital front door to healthcare for the average person in Nepal. So how are they doing it? Well, first, they've built an e-commerce platform for genuine medicines, which is a huge deal in a market flooded with counterfeits. Second, they offer video calls with doctors, a total game changer for privacy and just basic convenience. But here's the killer feature. You can take a photo of your paper prescription, upload it to the app, and they digitize it and deliver the medicine right to your door. So simple, but so powerful. All right, let's move to the next layer. While Givi is focused on the patient, a company called Cogent Health is going inside the hospitals and clinics to fix the system from within. They're taking on the absolute chaos of paper records and disconnected data. And the founder's vision here is absolutely key. They're not just trying to sell software to one hospital at a time. As he says, the goal is an entire ecosystem where your medical data can just flow, from the lab to the pharmacy to the specialist. Think about it. No more carrying around a giant folder of paper records every time you see a doctor. This fundamentally changes the quality of care. And that brings us to the third and, honestly, the most scientifically ambitious layer of this revolution, Biovac Nepal. This is where cutting-edge biotech meets the brutal realities of the Himalayas. They are laser-focused on solving that last-mile problem. And what they're doing is just brilliant. They're not just importing Western technology, they're redesigning it for Nepal's actual constraints. They've literally created a lab in a backpack that can do DNA sequencing on-site in a village. And get this, they've developed vaccines in tablet form that don't need to be kept cold. That completely leapfrogs the entire problem of the cold chain, which is one of the biggest barriers to vaccination campaigns worldwide. So just to quickly recap, you've got these 3 tiers of innovation. Givi is opening the front door for patients, Cogent Health is building the digital highways between hospitals, and Biovac Nepal is creating the breakthrough tech to reach the last mile. 3 companies, each solving a critical piece of the puzzle. But let's be clear, none of this is easy. These companies are in a constant battle. On the one hand, they have some powerful tailwinds helping them along. Nearly everyone has a mobile phone, and there's growing support from the government and investors. But the headwinds are just brutal. A massive digital divide, constant power outages, and a relentless brain drain of talented people leaving the country.
And this chart really shows you the single biggest barrier they're up against. Yeah, lots of people have phones, but that doesn't mean they have internet. Look at the difference. In the capital city, Kathmandu, you've got almost 80% internet access. But out in the rural areas where these digital health services are needed the most, it's less than 18%. That gap is just enormous.
You know, the problem actually goes even deeper than just access to the internet. According to the World Bank, an absolutely staggering 91% of adults in Nepal can't perform a basic digital task like copy and paste. Let that sink in. You can give someone a smartphone and free data, but if they don't have the skills to use the app, the technology is useless. The skills gap, that's the real mountain to climb.
But here's a really optimistic and surprising twist in the story. Because of these very challenges, something remarkable is happening. Nepal is no longer just a place for low-cost call centers. Major U.S. healthcare companies are now setting up sophisticated engineering hubs in Kathmandu, building complex AI and data systems. The country is unexpectedly becoming a source of world-class, battle-tested tech talent. So what does the path forward look like? Well, it seems to be a two-pronged approach. You have to continue supporting these grassroots innovators from the bottom up because they know the problems better than anyone. But at the same time, you need a massive top-down effort from the government and its partners to bridge what we can call the triple digital divide: access, affordability, and most critically, skills. And that's really the bottom line here. The heroic work of these startups, that's the spark. But a spark can't transform a nation on its own. To turn these incredible individual successes into a true nationwide healthcare transformation, it's going to take a deliberate, coordinated strategy. Which leaves us with this final, really powerful question. We're seeing innovation that was born from the most extreme constraints imaginable. So could this model, this specific type of resilient, real-world innovation, not only solve Nepal's own health crisis, but actually position the country to become a health tech exporter for the entire developing world? That is the billion-dollar question.